right. Well, hello. Welcome to the AUR Grand Round session or webinar series. I am Cecilia Mercado, and on behalf of ACER, I am happy to introduce our Grand Round speaker, Omer Awan. He's coming from University of Maryland School of Medicine, where he serves as Associate Vice Chair of Education for the Departments of Diagnostic Radiology and Nuclear Medicine. His topic for today's session is how to give an effective presentation. There will be time at the end for questions, a Q&A session, about 15 minutes. So please drop any questions that you may have in the Q&A box, and we will get to them after the presentation. So Omar, thank you.
Awesome. All right. So let me share my screen here, and let's start this. All right. So I'm thrilled to be here. Thank you so much, Cecilia. Thank you, AUR and ACER. I'm thrilled to be giving this talk. This is a talk, very general and broad talk. Honestly, I don't think for people who have been doing education for some time, I don't think anything that I'm going to say is going to be very earth-shattering, but hopefully it'll be provided in a framework or in a way that may resonate with you. And hopefully maybe the organization of it will allow you to think about how to give a talk and how to be a little bit more effective when delivering a talk, whether that's to medical students, to residents, to fellows, or just any talk that you really want to give. You know, really the principles here are very general and very broad. So I'm hoping that it will be of benefit to the majority of you. So, you know, these are my disclosures here that I have to disclose. I have a YouTube channel. I'm a public health contributor for Forbes, and I'm the teaching and learning lead for Aquifer Radiology. So what I really want to do is just, you know, very general and very basic. I want to just describe the intrinsic qualities of all great speakers, things that are common to, you know, when you think about a great speaker, what is it that you think about? And then just to provide a blueprint for how do we optimize content that we're creating, and how do we deliver that content in a way that's going to make an impact on our learners. So what's the problem? What's the problem that, you know, most people have when they're giving a talk, or when they're giving, you know, a talk to a society talk or a resident talk, a medical student talk? What is the problem? Well, if you think back, you know, we've all gone, or everyone on this call probably is an MD, and we've gone through medical school, and we're great at what we do, right? We're great, and you know, we're great at diagnosing cases. We're great at making differential diagnoses. It's because we've been trained, right? We've been through medical school, we've gone through residency, some of us have gone through fellowship, and you know, we have expertise in this. We have had formal education in this science. But how many of us have gotten formal training in medical education, right? I mean, very few of us, if any of us, right? You know, some of us, of course, you know, end up getting PhDs or masters in education, and that's fine. That's formal training. But the vast majority of us don't do that, right? We don't really get trained to teach. Yet teaching is a skill that's just as important and takes as much, you know, repertoire as anything else, including research or doing clinical work, right? So we're all expected to do this, right? The day we become an attending, it's like, okay, you have to go and teach residents, you have to teach fellows, you have to teach medical students. But the vast majority of us, 95% of us, have not gotten that training. So that becomes a problem, right? That's a problem. And that's why many of us struggle when we actually do teach. So I'm hoping that this poll everywhere will work. So I would love for everyone to, and there's a couple questions that I have, you know, throughout this lecture. So I'm hoping that, you know, this poll will work. So if you can go on your phones or your computer and go to polev.com/Omer456, you should be able to access this poll and answer some of these questions. So I would love to have some audience participation since this is Zoom and I can't see you guys in person. So I would love to have you guys, you know, answer some of these poll questions. So, and we're gonna start off really basic. You know, have you ever given a lecture before? Yes or no? So I'm expecting everyone to say yes to this, but we'll see. Maybe people have not given a lecture before, but you know, there'll be 4 or 5 questions throughout this lecture. So would love to have people interact. So again, it's polev.com/Omer456. Is it working, first of all? Can anyone tell me if it's working? Maybe in the chat.
Yes.
Okay, awesome. Good. So have you given a lecture before? Yes or no? Let's advance it. I just want to see what people say. Okay. All right, so 9% of you guys said no, so I'm assuming one person said no, but the majority of you have given a lecture before. Good, so I just wanted to start out very easy, and I wanted to provide the formula for success for all lectures. Of course, I'm just joking. There's no secret formula. This is just like a huge algebra derivative. I don't even know what this is, but there's no formula for success when you give a lecture, right? I mean, the amount of amazing lectures there are as diverse as the amount of people that are giving them. If you take a look at TED Talks, right, they're all given in different ways, but yet they're all highly impactful and highly successful, right? You can imagine if you take a look at all the people that have had impact on you, and you think about all the great teachers that you've had in your life, they've all been very different, right? I mean, you can obviously see that, some of them may have used certain different techniques. Some of them may have been really, loud and verbose. Others may have just been really quiet, humble, but yet they've all had a resounding impact on you, and they've all been very successful. So really, there's no real formula for success in terms of how to give an effective lecture, but there are certain principles and there are certain qualities that most people effective teachers and effective educators have when they're giving lectures. And that's really what I want to highlight, when we talk about this today. A lecture is really a journey, taking someone from point A to point B. There's a famous quote where like Chris Anderson once said that, he sees a lecture as, going through a journey and seeing the world differently afterwards before he saw it before the lecture. And that's really the way a lecture should be, right? Like your learners and your trainees should really see your concept or see the content in a way that they didn't see it before. And if you haven't done that, then you haven't really succeeded giving a lecture, right? So it's kind of like going up a mountain or going from point A to point B and, bringing people along with you in that journey. And if you're able to do that successfully, you've made an impact, or you've imparted something that's very useful to your trainees. So, this is how I like to see a lecture. I love to see a lecture like this, coming and taking people from point A to point B, bringing them along with me and allowing them to see something in a way that they didn't consider before, or in a way that, resonates with them now that they didn't, 1 hour prior. This is the goal of a lecture. And this is how I hope you guys also see a lecture. But there are key components to all successful presentations, right? And I want to highlight 3 of them very broadly. Intrinsic qualities of a speaker. So all great presentations have speakers that are very vibrant and have certain qualities that we're going to talk about in just a second. The content is also important, right? You have to have content that's great, content that is going to, be well received by your audience and is meaningful and is purposeful. And then also the delivery of that content is extremely important, right? You can have 2 exact same PowerPoint presentations, and one is going to be well received and successful, and the other is going to be terrible. And it has nothing to do with the content, obviously. Right? It has to do with the delivery of that content. That has to be optimal for there to be a resounding effect on the audience. So all these things are important. These 3 things, and this is what we're going to talk about today: the intrinsic qualities of a speaker, the content that you deliver, and then the delivery, how you deliver that, because how you deliver it is just as important as the content itself. And I think this is where some people, don't understand, that how you deliver it is just, you can have amazing PowerPoint slides, but it may still not be a good lecture, right? So very important to consider these 3 things when you're giving a successful talk. And, this is just an image, right, of Martin Luther King. I just want to throw this out there. Martin Luther King Jr., Barack Obama, Hillary Clinton. And this is not meant to construe any political ideologies or anything like that. I'm not a political person. If anyone knows me, they know that I'm not political. But I think all of us would agree that these are all great speakers. These are all phenomenal speakers. Well, what is it about, what do they all have in common? What is it that they all have in common? And I would love to, just open up the chat box and see what people, if you can just type in some things like, what do Martin Luther King Jr., Barack Obama, and Hillary Clinton have in common? I'd love to, I would love to hear what people think about this in the chat. If anyone could just, write 1 word, 1 or 2 words about what people think. Sense of confidence. I love that. Okay, Cecilia said sense of confidence. Absolutely. They're all confident, very confident. Anyone else have anything to say? All right, we got a quiet crowd here today. That's okay. Well prepared. Okay, I like that. Well prepared. Okay, yeah, they are well prepared. That's exactly right. So yeah, these are some of the things, right? They're confident, they're charismatic, maybe another word that people may want to use. They are able to invoke sense of emotions in their listeners or their audience. They care about what they say. Maybe they're compassionate. All these things are things that they have in common, which makes them highly successful speakers, right? Great voice. I like that. Joe Phillip, awesome. Joe, welcome, Joe. Great to see you here. So all these are very good. So what's the most important quality of an effective speaker to you? So these are 5 things that I've outlined here: the ability to inspire, eloquence, relatability, confidence, or clarity. What's the most important quality of an effective speaker to you? And I'd love to hear what people think about this. What the brand, of course, there's no right answer. I just want to hear and see what people think about, what's important for you guys, and what's an important and effective for you. What stands out of these 5 qualities here? All right, so most people said, ability to inspire, about 50%. Some people said eloquence, 20%, relatability, confidence, and clarity. And I would also argue that ability to inspire is the most, for me, that would be the most important quality of an effective speaker. If a speaker can inspire me to do something, or inspire me to change, or inspire me to think about something differently, then to me, that's the hallmark of an effective speaker. Of course, I think all these other things are also very, very important, but this is what would stand out to me. So ability to inspire, I agree. I 100% agree. I think that to me would be the most important quality for a speaker. And if you were to do a word cloud of a great speaker, this is what you would get. You can see that, the word communication is right there in the center. Obviously, great speakers are excellent communicators. They know how to tap into the audience. They know how to change their talk or their speech if things aren't being well received. They speak clearly, effectively, so that people can understand them. They speak at a nice tone. They go at a nice pace so that people understand them. People tell me I tend to talk fast. Great speakers are ones that don't talk fast, but don't talk slow either. They have just the right pace so that people can understand them. They connect. Notice that connection is a word here too. They're able to connect to their audience at a very high level. They have great discussion. They're people friendly. They're social. Conversation, messaging. Their messaging is clear. All these things are all very important when we think about what a great speaker is and who a great speaker is and how we can be impactful and how we can be effective as educators. But I'm going to really highlight 4 intrinsic qualities of a great speaker. And I want to talk about these because I think these are really important when it comes to med ed. Specifically when we talk about medical education, I think being engaging, being relatable, being confident, as Cecilia said, and being passionate. These to me are the 4. And this is my opinion, by the way. This is, nothing, there's no science behind the 4 that I just chose, but based on my experience in med ed and, the time that I spent in medical education, these 4 to me are things that really stand out when if a speaker is engaging, they're relatable, they're confident, they're passionate, they really stand out in the medical education space as someone that is, an excellent speaker, an excellent teacher and educator. I want to start with engaging because I think this is extremely important, especially in the world that we live in, because engaging your audience is a problem and a challenge, right? I can only imagine, everyone, how many of you guys have given a talk and literally you have your residents or your med students on their phones, they're surfing the net, their eyes aren't on you, and they feel like they're disengaged. I'm sure all of us have experienced this at some point, in their careers, right? So how is it, engagement is all about attracting your learners. How is it that you can keep their attention for the entire lecture, whether it's 5 minutes, 30 minutes, or 45 minutes, right? How can you keep their attention? This is the challenge. This is a challenge. And the more engaging you are as a person, the better you will be as a speaker, right? So how is it that you can keep your attention to learners, right? You have to ask yourself who your learners are, right? Teaching medical students is a lot different than teaching residents. That's a lot different than teaching fellows, right? So it's very important to consider who your audience is. You cannot prepare a lecture without considering who it is that you're talking to, because you want to make sure that you tailor that talk to your audience, and your engaging tactics are going to be different depending on the learner that you are. And depending on the audience that you are, right? A very common example for me is that, I teach medical students, residents, fellows, but I also teach Sunday school, middle school kids on the weekend. So I teach at my local mosque, and teaching them is a lot different. And quite frankly, for me, it's a lot harder because it's very hard for me to engage, middle school students who don't want to be at Sunday school. No one wants to be at on a Sunday learning. They certainly don't want to be learning about religion. So it's very hard. I find it very challenging to teach, those middle school, Sunday school kids on the weekend. So, that's a whole new challenge. So how do you engage that? It's much different teaching them than it is teaching medical students or residents. There's always a conscious and unconscious bias of learners. Studies have shown that, and this is true, literally within the first 15 seconds of giving a talk, your audience will have already preconceived what they think about you, like whether you're confident, whether you're going to be a good speaker, whether they want to listen to the talk. You guys have already made that assertion about me. So I don't know, hopefully I passed the test and you want to listen to this talk, but this literally happens. So how you project yourself really at the beginning, first impressions do matter. There's always this conscious and unconscious bias where people perceive you a certain way, and they perceive you as someone that they want to listen to, or someone that's confident, or someone that, maybe is unsure of themselves, or they don't want to listen to. So all these things are very important to consider when you are giving a talk. So often your audience will tell you how you're doing, right? If your audience looks something like this I can't tell because this is on Zoom, but of course, if you're live, if they're clapping, they're smiling, the audience tells it all, right? Or else if they're sleeping, they're looking at their watch, they're just looking and they can't wait till the talk is over. That's obviously not a good sign, right? So your audience will often tell you exactly how you're doing in terms of engagement. And so always pay attention to your audience and, tailor your talk to your audience. Well, how do you engage your audience? What are some ways that you can engage your audience? And we're going to talk about more advanced ways later when we talk about content, but just in terms of basic ways. And these are all, what I'm about to tell you right now is really what you learn in first grade or second grade of school. And it may sound funny that I'm mentioning this, but honestly, most people don't use the things that I'm literally about to say right now. And a lot of it is your eye contact and your body language, right? Like it has to do with, how, are you forming eye contact with your learners? Are you projecting and using your hands, your movements in a way that's showing that you're engaging them, right? The more you do that, the better you're going to attract the audience, right? The more you keep firm eye contact with your learners, the more purpose you show, the more serious it is that your learners will perceive you, the more they'll realize that you're purposeful about your message and that you care about your message, right? So all this is extremely important. Where are your eyes? A lot of times I see, and this happens, I see people when they're giving PowerPoint presentation, they're looking at the screen or they're looking at the computer or the projector. They're not even looking at their own trainees, right? Or their own learners. And that, how can you engage your audience when you're not even looking at them, right? And this is a very common problem that I see in especially radiology lectures. When I look at radiology lectures and I see attendings or, anyone that's giving the talk, where are your eyes? Your eyes should really be on your learners to maintain maximum audience and, engagement. Smile, right? Like show your humanity, be someone that is liked, well liked, and that people want to see you and want to look at you, right? The more you smile, the more positive attitude that you exude, the more people will be attracted to the message that you have. And simple hand movements like what I'm doing right now can be purposeful. Sometimes they can be distracting. So you don't want to overdo it, but sometimes simple hand movements are very good. Even walking around during a lecture, right? So, studies have shown that those who walk around have greater engagement. I've seen actually at AUR, since it's an AUR talk, I've seen like Dr. Mark Mullins from Emory, he often walks around when he gives his talks, right? Or when he gives, the neuro board review to residents, there's a reason he's doing that, right? There's a reason because he's trying to engage his audience. He's trying to, attract his learners by doing that, right? So walking around can be a very powerful tool when you're giving a lecture. That ultimately you're trying to make a personal connection with your learners, right? You cannot, if you don't do these basic things that you learn in grade school, how can you connect with your learners? How can you make an impact on your learners? I want to show this quick video and I'm hoping this works. And if it doesn't, please let me know. This is a YouTube video. It's like 2 minutes long. I think it's a nice 2-minute engagement series on how to engage your audience. So let's see if this works. Hoping it works, but can people see the YouTube screen or no?
No, I just still see your slide.
This is your summer to smile with accidental.
Let me reshare. I think I'm gonna have to reshare. It's okay, and I can do that. So I'm gonna stop share.
Why did I get promoted?
Give me 1 second, guys. It's okay. All is well. I'm gonna stop sharing.
Because I'm awesome. And because I'm using WordTune. Last week, I almost sent Nate, our graphic designer, kind of a bossy message.
Oh,
but
I
then
see it now.
Yes, yes, we can see it now.
My dad came over to me and said, son, it's okay. You flunked your exam.
Load.
You already got arrested. One of the most important things that you need to realize is when you get nervous, you try to cover your vital organs. And that's why you would see a lot of speakers sometimes fold their hands, bring their hands in front of them. And that's a sign of nervousness. Great speakers keep their body open, so there is no barrier between you and me. Raise your hand if you have an emotional mother. Let me see. Put them all together, you get mama. And something that when you're starting out, you got to be very conscious about is keep your body open. Here's tip number 2. Have your palms open. Do this exercise with. Take a look at your palms, turn them around. Take a look at the inside of your palms again. What side relaxes your eye? If you really concentrate, when you look at the inside of your palm, your eye relaxes. And a lot of great speakers, they open.
Sorry, it's just, I don't know why.
Palms towards the audience, showing a more openness. And that allows the audience to connect with the speaker better, as opposed to showing the back of your hand. Ladies and gentlemen, today I'm a dreamer, I'm a speaker, and I learned the unfailing quality of unconditional love from my wife. Number 3, get comfortable with the stage. When you're comfortable on the stage that you're speaking on, your body is free to move about, use body language. But if you're not comfortable with that stage, and if you feel foreign on that stage, what happens is your body language starts to constrict and you start to cover your body up. And when a son sees a mother cry tears of shame, that's a life-changing moment. She looked at me and said, son, I want you to be a better man. Whatever you do, don't touch the podium. As soon as you do that, you're going to be leaning on it. You're going to be shaking that podium, and you will be doing all sorts of things on the podium. So what you do is you keep a comfortable distance between you and the podium. You can keep your notes on it, but you can use your hands to gesture. Don't rest your hands on the podium. So keep a distance, and you can gesture, use body language as you want from a little distance from the podium.
All right, so hopefully that was helpful. Let me come back to my presentation. I find that, even though it was like a 2-minute video, I thought it's very, really practical, really practical in terms of the way you give talks, the way even your hands are, palms open, your distance at the podium, being comfortable. I mean, I think it's just, very practical, but how many people really use this advice, right? So that's why I wanted to share that, quick video. So being relatable is also the second intrinsic quality of a great speaker. So, how many of us are really relatable to our trainees, right? Many of us are many years older than our medical students, residents, or fellows, right? And, being relatable really requires us to put ourselves in someone else's shoes, put ourselves in someone else's shoes and think about how they feel, what they need to learn, and what they need to know, right? So, some of us are even decades, they're, decades older than our trainees. So remember that our learners are millennials and Generation Z learners. So we need to put ourselves in their shoes and make sure we think about what they need before giving a talk. That's the first thing you really should do. Before you give any talk, you should always think about your audience, right? Like, what is it that they need before giving a talk? And then tailor your talk to their needs, tailor, and we'll talk about this a little bit more later, the presentation is about them and them learning, right? So, and their needs, and that's the most important thing. How can you make the topic as simple as possible for your audience to understand? This is a huge point that I want to stress, because the bottom line, some people think that, the more complex that they talk, or the more, information that they give, or the more sophisticated it is, the better the presentation is. And that couldn't be more false, right? The best educators are the ones that are able to simplify complex topics, right? If they can say it in a way, if you can deliver your talk so that the most struggling student or resident is able to get what you're saying, you have literally succeeded and you're a master educator. It does no good if you can feed information that the people that are already at the top of their class, they get it, but no one else gets it, right? So, it's not about showing off how much you know, it's about you doing it in a way that everyone can understand your talk. And I think that's a point that many people don't understand when they're giving, certain talks. So how do you be relatable? Well, you have to put yourself in their shoes, right? Think deeply about what your learners need, right? One way you do it is by putting context in your talk. So for example, I'm a musculoskeletal radiologist, if I was giving a talk on, necrotizing fasciitis, I would say, you see this gas that's insinuating between fascial planes. This is the imaging finding of neck fasc. So the next time you're in the ED at 3 a.m., if you see this gas, pick up the phone and, call the surgeon and let them know that this could be a case of necrotizing fasciitis. So by putting this in context, by showing them that, hey, okay, I kind of know what it feels like to be on call. I know what it is, being up at 2 a.m., making that phone call. I put this in context, I become more relatable, right? So, doing these things and trying to make yourself more relatable is huge in terms of, making yourself an effective speaker from an intrinsic quality standpoint. Being confident. Cecilia, Dr. Ricardo talked about being confident. And I want to ask this question, what do you guys fear the most? And you can write this in the, when you're on the web here. If there's one thing that you're scared of the most, what is it? It could be anything. It could be, it could be heights. It could be flying, giving a talk. I mean, whatever it is, whatever you fear the most, what is it that you fear the most? I would love to see what people say on this question here. Give you guys a few seconds to answer this. All right, let's see what people said. Oh, I didn't see the answers. Okay, that's interesting. Okay. Let's see if I can. Failure. Okay, somebody said failure. Okay, good. Awesome. Good. All right, so I will say that yellow jackets. Okay, cool. Yeah, so I mean, actually they did a poll. They randomly sent a survey out to like random adults. And the number one thing that people feared was snakes. That was the number one thing that people feared. And the number two thing was actually public speaking. So actually speaking in front of a crowd, that's what people feared. So, I think confidence is key. And confidence, some people have it innately. Some people are naturally more confident than others, but it's something that can be developed. And I always think about it as, shooting free throws in basketball. I love sports. You get good at free throws by constantly doing it, by doing the motion of shooting a basketball, right? The more you do, you practice. Like Kobe Bryant was amazing, right? Because he shot hundreds of free throws every day in practice, right? So when it came time to the game, he could make them with his eyes closed, right? Because he did it so often, right? The same is true with speaking. The more you speak, the better you get at it, right? And this develops confidence. This builds confidence, right? So practice makes perfect. So the more you do something, the more you do. But what else can you do? You can record yourself. I'm on Zoom right now, right? Everyone has Zoom now, since the pandemic. You can record yourself and see how you did, right? Okay, did you talk too fast? Did you enunciate the words correctly? Did you do it in a way that people will understand? And critique yourself. Literally recording yourself can be a very valuable tool in helping you figure out and to build your own confidence. Have someone critique you. Every institution is filled with master educators. Talk to someone that you trust, someone that you think is a great speaker or a great educator, and be like, hey, listen, like next time I'm giving this case conference, can you just come in and just listen to me? And I would love to hear your feedback on how I did or what I can improve. So these things are all very powerful tools, not only making you get better, but also building your confidence, because the more you do this and the more people give you feedback, the better you become when you implement this, right? So, confidence is very key. And, confidence is very palpable. People can feel and sense how confident you are in the way you're speaking and the way you deliver a talk. And this last quality before we talk about content is being passionate. This is my favorite characteristic, passion. How passionate are you? How much do you really care about your topic? How much do you care about your students and your time, right? Because the bottom line is, if you don't care about what you're talking about, how do you expect anyone else to care about what you're talking about, right? You have to exude this passion, this care, this excitement about what you're talking about. The best teachers that I've ever been around are the ones that are very passionate about what you can tell that they care and they love what they do, right? When you give a talk, when you're there to give, a case conference or a medical student conference, bring your A game, right? Like, all your energy, your tone, your enthusiasm gets translated into your talk, and then people receive that. People receive that, and they form impressions about how you're doing. And the higher energy you are, the tone, the way you're discussing it, all, really becomes a very palatable trait for people. So this is very important. Being passionate and caring about, and this is something that all of us can do. This does not require training. This requires just you having a heart and you wanting to do it and showing your enthusiasm, right? How enthusiastic are you? How motivated are you to inspire your learners? All very important. Okay, so those are the 4 intrinsic qualities, but I want to go now to the content, and we're going to talk about the content and the delivery of that content. And we're going to first talk about, how to maximize your content by being audience-centered and being engaging. And we talk about being engaging as a speaker, but now we're going to talk about engaging, having the content being engaged. So first of all, this is also very important. The lecture is never about you, right? It's always about the people that are learning, right? We're not here to be selfish. We're not here to show off our learning or how much we know. We're here to help someone learn something so that they can implement it in their careers, right? The lecture is always about them. It should always be audience-centered. Audience-centered is a very fundamental principle for giving great lectures. How do we do this? We focus on their needs. And when we do this is we ask ourselves before we give the talk, well, what competencies do the learners need to learn? If you're giving a talk on do not miss cases in the ED, which cases do they really need to see for them to be confident so that they're successful in the emergency room, right? And we do this often by writing learning objectives. We all know about Bloom's taxonomy. This is why we write learning objectives, to keep our talk audience-centered, right? This is literally the reason we talk. Every med-ed person knows about learning objectives, Bloom's taxonomy, the use of action verbs when we do them, but why do we do them? And the reason is to stay focused to the audience, right? To keep it focused so that learning is relevant to them. This is why. This is the whole reason for why people are sticklers about making learning objectives. Even like AUR, like ARS, RSNA, like all these, they always want learning objectives before every talk, right? Like this is why, so that they know that the talk is going to be focused to the people that need the information the most. The purpose, of course, is to teach them, not to show off how much you know. And this is, I'm sure everyone has seen this pyramid, this Bloom's taxonomy here, but I think it's worth just showing again because it's that important, right? Notice that the higher up you go on this pyramid, the more higher order the objectives are. We want to be at evaluating, creating, and remember, we're always using action verbs to discuss and to articulate what it is, what competency that we are trying to reach. So this is a very fundamental way to keep your talk audience-centered, about the learners, not you, but about the learners. Another way is just to remember diversity. So appealing to a diverse array of learners. Remember that some people are auditory learners. They learn by hearing. Some people are visual. They learn, and radiology is inherently very visual because we show a lot of images. So people learn by seeing. And some people are kinesthetic. They learn by doing or by action. The best educators appeal to all types of learners, auditory, visual, and kinesthetic learners. So that, auditory learners, they may enunciate words and raise their voice or their tone when they're discussing or for emphasis, right? For visual, they may have great images of like pathology on CT, MRI, X-ray to show them, or have great effects on PowerPoint. Kinesthetic, they may ask people to do things by asking questions, or have a flipped classroom, or have them do an in-class exercise. Do group peer-to-peer learning. This is all kinesthetic learning, right? So if you are able to combine all of these tactics and appeal to the different types of learners, then you're going to be successful, because people all learn differently. People all learn, and you have to appeal to all of them, because some of your learners may be more auditory, some of them may be more kinesthetic. So you have to be able to tap into how they learn effectively and to do it in a way that appeals to all these types of learners. You also have to appeal to all different levels of residency. So in radiology, you have PGY 2, 3, 4, and 5, and they're all at different stages, right? So when you're giving talks, you have to appeal to all of them. So it's not smart to give all advanced cases or show all advanced cases. It's not smart to give all basic cases, but you should have a diverse array of cases that are tailored to different levels of residency, right? You should have different teaching points. Even if you're giving a didactic talk, have different teaching points for junior residents and different teaching points for senior residents, so that it's relevant to all of them. It's audience-centered. Remember, it's always audience-centered. Even medical school, teaching 3rd and 4th year medical students is a lot different than teaching 1st and 2nd year students, right? And medical students are different than residents. medical students are not considered adult learners by the principles of andragogy, right? They're more motivated by things like doing well on exams like USMLE, whereas residents and postgraduate trainees are more motivated by just learning for the sake of learning to apply it for their careers. So always important to keep these, motivations, ambitions in mind when you're developing lectures. Now, the content also needs to be engaging, right? It needs to be done in a way that appeals and attracts their attention. Well, there are tons of literature out there, which, I've outlined some of it here, but there's much literature out there showing that different active learning techniques really help in engagement and in learning in the process. And, before I get to, how we use them, I would love to hear, what's your favorite audience response tool? This audience response tool is one of the techniques that is used to increase engagement in learners. Is it Poll Everywhere, like I'm using right now, Kahoot, Nearpod, point clickers? I'm sure there are others that I'm not mentioning, but would love to just get a sense for what people are using and what they think is their favorite for audience response. Give you guys a second just to kind of get through that. All right, let's see what people thought here. All right, so most of the people thought it was Poll Everywhere, some with Kahoot, some with Nearpod. Yeah, I mean, I like all of them actually. I like Poll Everywhere for certain reasons. I like Kahoot for some reasons. In certain situations, I like Nearpod. I don't like point clickers as much, but yeah, I like the spread here. But there are many different innovative teaching methods that you can use. One of which is audience response. So audience response is a great way to anonymize, questions so that people don't feel like they're ostracized, or it's not punitive. Like if you get something wrong, no one's going to know, and it's all good. The learning space is very safe, right? It's also a way to get everyone engaged so that people commit to answers, right? Flipped classrooms. This is a real evidence-based technique that people use that they can really augment learning. Our trainees really favor this type of technique, by giving people homework assignment before the lecture, whether it's like watching a YouTube video or, reading an article and then coming back and then talking about and applying that knowledge with higher order learning, right? This is a technique that is very favored by medical students, residents, and medical trainees. Games, just doing games, right? The inherent competition between games, like even doing like Pictionary or something, this can be very effective when you're teaching, and, it's been shown to really augment, engagement. And of course, drawing, especially if you're teaching anatomy, having people draw anatomy can be a very active learning skill, and it can result in increased engagement. So these are just some of the things that you should think about when you're designing your talk, and, being able to incorporate this when you're giving your talk. So, I think the two most common audience response tools used are Nearpod and Poll Everywhere, especially for radiology trainees. This is just, kind of a compare and contrast. I think both are very good. They both can be free for up to, less than 40 students. There are some advantages, so for example, I think Nearpod is much better for incorporating videos. Like if you want to have like a YouTube video that you want to embed in there for like 20 or 30 seconds, I think Nearpod has like a nice interface to do that. They both have like a nice versatile array of questions, like multiple choice, open-ended, survey, free text. The other interesting thing is that you can get data analysis on Poll Everywhere. So you can use that as a premium feature. So you'd have to pay for that, but you can track your students to see how many things they got right, how many things they got wrong, and that can be used for improvement in the future. So, data analytics is, I think, the future of med ed, and you're able to do that, kind of with Poll Everywhere if you're willing to pay a little bit more money. But both are very good, have great questions. You're allowed to have image-based questions for both of them, which is very pertinent for radiology. So, very nice tools for audience response. That are good. And Kahoot is also very good, which I didn't, specifically talk about. But I want to just turn and talk about, well, then how do we deliver this content, right? Because ultimately, you can have great content, you can have a great PowerPoint, you can have, audience response, but if you're not delivering it effectively, then it doesn't have the same impact, right? And two of the same talks can be delivered excellently or very poorly based on the person that's doing them. So I think one key point, and I'm only going to talk about 2 points, focusing on details and telling stories. So focusing on details is very important, because if we take a look at this, the average lecture, in medicine or surgery, radiology ranges from anywhere from like 30 minutes to 90 minutes. Most of them are like, 45 to 60 minutes when you give like, didactic lectures or case-based conferences to your residents. That's a decent amount of time, but, it's not a lot of time. So why is it that we get so anxious to cover every single detail? Like I think back to, when I was a resident, I remember like one of our attendings giving a talk on like imaging the spleen, and like they literally like just told everything known to man about the spleen in that talk. And they just crammed like 100 slides in a 60-minute presentation, went through every single pathology that's available in the spleen. And like I walked out thinking like, I don't think I even learned anything from this. You know what I mean? Because like they talked about like literally everything, but why is it that we feel that we should talk about everything and be so comprehensive? I think a better technique is just to focus on details, right? Focus on like what people really need to know, right? Like even if you talk about, sometimes less is more. Like even if you, maybe talk about five or the top 10 best diagnoses in the spleen for splenic pathology or splenic trauma or something, that will have a more resounding effect on your learners, and they'll walk out learning something, right? The key is that if your trainees walk out learning something new, that's better. And that's more effective than them walking out saying, oh yeah, I got a nice overview of the spleen, but I can't really apply anything. You know what I mean? So I think, less is often more. So focusing on details. And, this is interesting because, everyone, this is an average PowerPoint slide in a radiology lecture. Look how many words are on this slide. I mean, like, first of all, the person who's reading this is going to start reading the lecture and not look at me or not pay attention to what I'm saying. And they're just going to keep reading this PowerPoint slide. And, it becomes boring and, no one's really paying attention. This is going to exacerbate cognitive load, right? When there's too much information on a slide, less is more. And these are the principles of Zen presentations that, Gar Reynolds talks about, having just fewer words, but more pictures, right? Keeping things simple, and because the bottom line is the slide shouldn't be dictating the talk. You are dictating the talk. The show is you. The slides are not the show. You are the show, right? So people's eyes should be on you, not even the PowerPoint. So the less words that are on the slide, the better. The less there is for distractions, the better. The less cognitive load there is, the better, right? So less is often more. So focus on just the details that you need to articulate for your learners to understand certain things. The outline and the layout of slides is extremely important when you consider, how to do these things. And just consider, there's no need to have like 10 teaching points on one slide. Consider just having one teaching point per slide. I think that often it resonates better with learners and they're able to learn things on a more high level, And I think telling a story is very good. I'm not a thoracic radiologist. I'm sure there's some thoracic radiologists here, but if I were giving a talk on, let's say, crazy paving, which, as you know, is when you have interlobular septal thickening and ground glass attenuation in the lungs, I would talk about my mom, because my mom once, when I was a radiology resident, came to the ED. She was coughing up blood. It obviously scared the heck out of all of us. I was panicking when my mom did that. She got a CT and she had crazy paving in her right upper lobe of her lung. I still remember to this day. Ground glass attenuation with interlobular septal thickening. It turned out just to be, a viral infection, but of course it can be associated with like cancer. It can be associated with like sarcoidosis. It can be associated with pulmonary alveolar proteinosis, a lot of other different things. But, if I was teaching crazy paving, I would teach it by telling the story about my mom, because then there's an emotional attachment to this, right? People are more likely to remember what crazy paving is because they'll associate it with my mom and what my mom went through. So telling a story can be very powerful, right? We're naturally drawn to stories. We're naturally drawn to great stories, and it adds this emotional element of it that allows us to learn, allows us to retain that information at a higher level. So you can't tell a story for everything, but the more you do it, the more interest you'll have, the more engagement you'll have, the more they're likely to remember what you're going to tell them. Okay? So I encourage everyone to try it sometime. So that's really all I wanted to say. These are just all basic techniques on how to give a good lecture. Hope we talked about intrinsic qualities on how to be a great speaker. And then hopefully we provided a blueprint on how to optimize your content, typically by being audience-centered, by being engaging, and then delivering that content by focusing on details and telling stories. So I'm hoping, I want to part with this amazing quote that I love by William Arthur Ward, that the mediocre teacher tells, the good teacher explains, and of course the superior teacher demonstrates, and the great teacher inspires. And our goal is to inspire the next generation of learners so that they can really benefit from all that we do. So I'm happy to take questions. This is my email. That's my YouTube page. Such an honor to be here. Thank you so much, Cecilia and AUR, for having me. And I hope you learned at least one thing from this talk, if nothing else.
Thank you. Thank you. Thank you so much, Omar. I mean, this is such a terrific session. I feel like all this pressure now to start to use a lot of these pearls in my talk. So we're opening now for questions, if you could put them into the Q&A. Okay, here's a question by Joseph Philip. How much flipped can you use with busy residents? I use flipped classroom.
Yeah, so Joe, I use it all the time, and honestly, it's very well received. So just last week, a couple of weeks ago, I gave a talk on meniscal tears, and what I did was I had them, watch a video on my YouTube channel on, MRI imaging of the knee. That was the pre-assignment, and then I gave them 5 anonymized cases on Paxman, right? So what I did was I gave them 5 anonymized cases on Paxman, and then I told them that they're going to work through these cases in groups, and they're going to present the findings, in class. And then, in class, they worked, in groups, they looked at it, and then they presented their findings, and that's what we did. And, this is very well received. I mean, the feedback that I get is, these are some of the best lectures that they received in residency. They enjoy, I mean, you think that they're busy and you think that they're not going to do the work. Like I'm always thinking like, oh, they're not going to do this pre-assignment. They're so busy. But when I asked them like, okay, who did it? Like they all raised their hands. Like I'm shocked at how much participation I get when you assign a flipped classroom, because they're yearning for this type of stuff. You know what I mean? Like, I think it's just sometimes we're our own block. You know what I mean? We think that we can't do this because, oh, they're not going to be responsive. They're not going to have the time to do it. But honestly, if you build it, they will come. You know what I mean? Like if you do it, they will do it, and they want to do it. And, this is the feedback that I've gotten. So I appreciate the question, but I think if you try it and see what happens. And I would love to touch base with you, Joe. I know you, Joe, so you can email me and say, hey, Omer, you're totally wrong. Or, oh, Omer, wow, like, this actually worked.
I just had a quick follow-up on that. Would you say that you could use the flipped classroom for every conference?
No.
So in other words, that the resident will be doing it, every day, let's say for prior to resident noon conference, or would this be more like a sporadic,
I try to be diverse even in the way I give conferences, so sometimes I'll use flipped classroom. Sometimes I'll do an audience response, session. Sometimes I'll just do a didactic with no audience response, nothing. I just do a normal. Sometimes I just do like a basic case conference with like hot seat. I really try to change the way I do all conferences. I'll probably do like 2 or 3 flipped classrooms a year. I will do it. I mean, it's the one that I think people enjoy the most. I mean, if you were to poll my trainees, they would say that that's the ones that they like the most. But I really try to keep it diverse, because I think there's a diverse array of learners. Some people may not like it, so I want to be cognizant of that. I want to appeal to everyone. So I want to try different things so that I can kind of, pinpoint all the different learners and, have them happy.
Any other questions? We have a quiet group. And curiosity about the flipped classroom, one more question regarding that. You asked them to have a reading session, or do you ask them to do a video, to watch a video, or what exactly, how do you do it?
You can do both. I mean, I've given them radiographic articles to read before a lecture, and then I'll have like a case conference. I'll give them a video on my channel to watch, and then we'll do either a lecture, or, I mean, there's like infinite amount of possibilities you can do. Then like, I can have a Paxman case setup where I have them do, peer-to-peer learning where they're working in groups, and then they discuss their findings and they discuss in front of the whole group. So that way there's, there's flipped classroom, there's peer-to-peer learning, and there's, just general discussion and engagement. There's so many ways you can do it. You can have a flipped classroom where you have them watch a video or read an article, and then have an audience response system where you have cases and you just have people answering questions on their phone. I mean, there's just literally so many combinations that you can possibly do. It's infinite. But the important thing is to do something to engage them. It's not even what you do. It's just you do something.
Okay, great. Do we have any other questions? I don't see any others in the chat. Okay. Well, then thank you very much, Omar, for such a really terrific session. Again, we will absolutely be using a lot of these pearls in our next sessions. And I also want to thank all of you that have joined us today. Have a great evening.